What does a nurse representative do? Like I've seen them, I've talked to them. What's really the mission of?
If you're not passionate about what you're doing, there really isn't any sense in it. Okay.
Hi, Sharon. Thank you so much for coming today. How are you?
Oh, I'm doing very well. Thank you, Elise, for inviting me. I'm really excited to be included in this podcast.
Of course. I feel like we're going to have a great time. First, I just want all my viewers out there to get a little more about you. So can you tell me about your nursing experience and your journey so far as a nurse?
Well, I'm an old timer. I graduated from the diploma course in 1972, and it's all I ever wanted to do in my life was be a nurse. And I had to jump through a lot of hoops to do that. And I was able to get there. It was hard for me because I had so many obstacles. But I loved my years in nursing. And of course, when I finished graduating, I couldn't get a job in the hospital. So prior to nursing, I worked as a healthcare aide in a home for mentally handicapped and deformed children. And I loved that. And so I went to apply there and they accepted me as a supervisor. So that started my nursing career. And from there, I eventually got into the hospital and worked from the supervisor to medical nursing to float nurse hospitals. In the midst of all that, to move to another city, I settled into long-term care nursing. And then I finished up as a nurse manager. And the only reason I left was because I had to have intricate eye surgery. And I was always interested in doing things on the side. So I always did something, like even when I was in nursing, I worked with different products that were unique. And so then from there, when I retired, I was able to work full time and fulfill my passion in what I do.
That's great. So as a nurse representative, you said you worked a little like different companies on the side when you were still nursing.
Yes.
Is it the same company that you transitioned to full time, or did you find a different company full time once you decided to make that your career?
No, I was not when I retired from nursing, I was not with the company I'm with now. Everything was about wellness because it gets into how I got into it was I had severe health issues and I had to look for solution because I nearly lost my nursing job. And I was very afraid of not getting back to the hospital because I wasn't able to function, even with daily activities. It was that severe. So what happened was the particular products that I worked with all along the way led me to really good health. So with having better health, I just wanted to share my passion with many other people because it made such a difference in my life. And particularly the company I'm working with now, the products are so unique. And it was just, I like to call it the icing on the cake for my health recovery. So I get really excited and I would tell people what I do, whether I got paid or not.
I've worked with some nurse reps when they've come to the hospital for either a medical device or a new drug that's being advertised. And you're talking about a different section or like subsection of being a nurse representative as health and wellness. But what does a nurse representative do? Like I've seen them, I've talked to them, but what's really the mission of being a nurse representative? What's the schedule like? What's some of the expectations?
Well, that could vary, I think, depends on what company one is with. For me, I make my own schedule, so that's very, very nice for me.
Yeah.
And I like to say I start with consultations. I like to do consultations because not everybody is in need of your particular product or service. And so through a consultation, I'm able to find out from that particular person, do they even have a need? And if so, what particular need do they have, whether it be balance or pain management or sleep issues, things like that. So accessing their needs. And then I work with a team. I have a team of associates. I am a practitioner, but I also have a medical doctor on my team from Michigan, and I have other practitioners as well, but a lot of mine are associates. So I manage my team and I encourage them and I support the whole team as a whole on the mission that we have to help 1 billion people. So supporting other people, whether it be my teammates or not, is important because we work all together. So that's really exciting because you get support from so many different people.
Yeah. And your field, just to clarify for the viewers, what's the umbrella term for what you're representing?
What I represent is what you call neurotechnologies. Now, neurotechnologies is fairly new. The research goes back to many years ago, 50 years ago, where they started studying neuromuscular science. But our particular products are solo products. They're not available from anywhere else. And so they're very exciting because you're on a mission to provide things to people that they can't find anywhere else.
Yeah.
So it requires a medical license as a practitioner to get into the company on the practitioner level. So I'm in the same category as doctors, massage therapists, chiropractors, and many other medical people, but we do have to have our medical license. So I always knew I would keep my registration for some reason, and I guess I found it. So I was really glad that I paid into the non-practicing class. So therefore, I'm still registered with the college and be willing to take online training, but you don't have to sign anything and you're certainly not committed. But I think it's the passion to join the mission that they like to see, because if you're not passionate about what you're doing, you know, there really isn't any sense in it. And also too, to really believe in what you do. That pretty well sums it up.
Yeah. Did they want any nurse joining the team to have experience specifically in bedside nursing or history of nursing in a particular type of field, or would they have taken somebody straight from graduation?
Oh, they would take anybody. I think it's just a matter of being able to learn and understand, you know, that you don't really have to have other qualifications. So you would have to be of age, of course, 18. But as far as associates, the same. There's no qualifications.
Okay.
I think just be willing to learn and certainly realize that there is a chance to learn so much. So we hear a lot of different training from other doctors and chiropractors as well. Sometimes it's even over my head, some of it, because it's so in depth.
When you get in as a representative to a company, whether it's medical devices or drugs or health wellness, I know it would vary across the board depending on the company, but what are some other doors or opportunities that tend to open for a nurse?
Well, I think with the nursing, it's again unique to our company, but certainly there's advancement into leadership roles. My position is called team leader, and so I manage a team. There's certainly a lot of people that have done a lot better than me for advancement. I am a senior, so I do like to, you know, still have some free time to myself, which I can do because I manage my own schedule. And being instrumental, I think just the advancement is great, but imagine being instrumental in changing somebody's life. Like really, some people, and I think my passion really stems from my own problems, because when you go to the doctor with your chronic conditions, they just don't have any solutions for you.
Yeah.
So I think that it's that part of it. So when you can offer something to somebody that has a medical condition that they have no answers for and they get amazing results, I think that that is worth it all.
I know every job has pros and cons, whether it be schedule, work-life balance, satisfaction, administration, like there's all these things that kind of tie into it. But for you, what has been some of the pros and cons over the journey of being a nurse rep?
Well, I always like to talk about the pros first, because to be inspirational in changing and helping so many people with drug-free wellness, because there's so many side effects for drugs where you're using something that is, ours are wearable technologies. So you're not putting anything into your body in the form of medicine or anything. So it's just a matter of wearing the product. It makes it very easily. Actually, I have one of my products on, and that is for mental clarity. And it is amazing how they work. So it is just an example of being in and offering something to somebody without any side effects. So that's definitely a pro. And of course, additional income stream is something that's beneficial for everybody.
Yeah.
the con, the only one I could think of was some people get discouraged when they're doing something new. And particularly when you're working with the public, you will run into a lot of people that are going to tell you no.
Mm-hmm.
And I have had associates that started to work with me, and they were not trying to talk to people very long at all, like maybe a month or two.
Mm-hmm.
And they didn't find a lot of people that were interested. So they just gave up.
Mm-hmm.
So that could be, but I don't give up because I've been doing this type of thing for a long time. And I realize that you're going to always find that. And same as if you were going in a store, you're not going to choose everything. You're going to choose what you're interested in.
Yes.
And then also too, I think sometimes, you might run into people that say no, but then maybe a month or 2 months down the road, or maybe even a year, they may have changed their mind.
Mm-hmm.
So I think that pretty well covers it.
Yeah. You're getting more into that interpersonal relationship of more of a sales team, because you're representing a product and the job is to sell the product, whether it be to a hospital or to an individual. And sales isn't for everyone, even though they like the other pros of it, the scheduling or the outside revenue stream. It kind of takes a special person who's willing to deal with that aspect of sales and the discouragement before the ultimate satisfaction of getting the wins, I know you've talked a lot about the pros, but what's been your favorite aspect if from the beginning of your career as a nurse rep to now?
Because I've always wanted to be a nurse and enjoyed my nursing career, I always wanted to stay in the field of medicine.
Mm-hmm.
So I feel to have something after nursing, a second go around, a chance to really stay active and still stay in the field you love, but having that medical field and still have a relationship with other people in that area. So that really means a lot to me. And also too, I always find that if you don't have anything to do after retirement, it's not very good, but definitely stay and have a passion and do what you still love to do, but in a different way, and to offer the people that need that.
Yeah, that's wonderful.
Mm-hmm.
What is some advice that you would give to nurses who are thinking about possibly becoming a product rep or wanting to do something outside of what they're normally doing, either because they want to or something's going on in their life like you, where they had to make a shift, especially when you don't necessarily want to shift? That's even harder to have to force to shift. But what would you tell nurses who are in that either desire or forced transition?
Well, I can resonate with that, Elise, because first of all, I would say when I had to leave nursing, I was really upset. Mm-hmm. So I didn't want to leave, but I had to leave because I had to have an intricate eye surgery, and I was very close to retiring anyway. So I just got early retirement. But to realize that there's other options. If you are forced to leave, there's so much to choose from, to really find out your passion. Because if you go with your passion, you're never wrong. Yeah. And, because you can become passionate about so many things. Like sometimes people will talk to me and say, well, buy this makeup or, buy this. And, I would not have any passion for that. Like there's a lot of things I could do, but to have the passion, and after that, to find out your why you want to do that. Because lots of times you could maybe with a good retirement income from nursing, just not do nothing. But so find out your passion and definitely find out why you want to do what you're going to do.
Thank you so much, Sharon.
Well, it was a pleasure.
This has been really great getting to know you, and I'm excited for our viewers that they've had a chance to get to know you and the possibility of being a nurse rep a little bit better.
Thank you.
Life is a winding road, no telling where it goes.